Welcome to Hegde's Implant Care, reliable and predictable implant solutions for all. Now, can we place implants in all situations? Now, what if I don't have adequate bone? These are the common questions we have been asked. So, today I'm going to talk about a case where in the upper jaw where there is insufficient bone and how do we manage it. Generally, to place implants, we need a good foundation of bone. When I say a good foundation, I would need at least generally we place at least 4 into 10 mm of implants, which means 4 mm wide and 10 mm length. So, which means that I need more bone than that, at least 5 mm of width and maybe 11 or 12 mm of height would be ideal cases. So, suppose we don't have so much bone, how do we go about it? So, in the maxilla, now there are some limiting structures. In the upper jaw, we have something called the maxillary sinus, which just goes around there. So, this sinus is very close to the bone. Sometimes what happens, this sinus starts moving down or the bone recedes slightly, it goes up, and finally we are just left with about 5 to 6 mm of bone, which is really not sufficient for dental implants. So, in such situations, how do you go about it? Now, generally we can either augment bone on top of the ridge, which means this is the ridge, this is the teeth area. So, in this part, below the or above the ridge, we can augment bone. There are some techniques for bone augmentation, we can do that. The other technique is on the sinus side of the implant, we can augment bone. So, both the places you can augment bone. So, today I am going to talk about sinus augmentation, maxillary sinus augmentation, so that we can add little bone and then place the implant. There are two techniques for sinus augmentation. The first one is called the lateral antrostomy, or else we call it the direct sinus lift procedure, or else the lateral window technique. This is the direct approach, and there is one more technique called the indirect approach, which is otherwise called the transalveolar technique, or else we call it the crystal approach. So, what are the indications? So, when do we actually go about it? I have a case here where in the maxillary jaw there is insufficient bone and we have to place implant. You can see there are 3 teeth missing. The first one is a broken tooth, or a root stump we call it. So, we have to extract that and place the implant, a relatively simple procedure. But posteriorly, we have to place one more implant, but the problem is there is inadequate bone. If you take a look at the CBCT report, we have just about 6 mm of height, but we have good amount of width, about 5 to 6 mm width we have. So, how do we go about it? So, this particular case I have planned for a indirect approach, okay, or else we call it the crystal approach. Now, why I have selected this? Generally, the indirect technique we do, it is a simple procedure. We do it in cases where we have to lift about 3 to 4 mm of bone, or 3 to 4 mm of sinus we have to lift and augment the bone. We use the indirect technique. So, in this particular case I have done that. You can see the picture, how we go about it. I have done the osteotomy. I have used my surgical drill. I have gone near the sinus, just about 1 mm short of the sinus. I have used the osteotome and have slightly tapped it, and I have lifted the sinus. So, when we lift the sinus, we have different size of osteotomes. So, sequentially I have enlarged the size of the osteotomy. Also, I have slightly lifted the maxillary sinus. So, I have done a lift of about 4 mm here. Once I have done the sinus lift, you can see there, that is the graft being placed. Generally, I would prefer to place a xenograft. In this particular case, I have used this BioOS, which is a xenograft, along with the bone chips, whatever has been collected. Along with that, along with the mixture, I have done the bone augmentation there. I have slightly placed the graft inside and then tapped it and then placed the implant. You can see the final picture there. That particular area is of where it appears a little wide is the bone graft which is placed. The mark which I have shown you, it is the bone graft placed, and you can see a beautiful tenting there of the X-ray, which means that the artificial bone is surrounding the implant. So, basically when there is no bone, we have created artificial bone in that particular area and we have placed the implant. Once we do this particular procedure, we generally have to wait about 5 to 6 months so that the bone formation takes place and it integrates with the implant. Once the integration is over, then we can place the crown on the implant. The technique I have spoken about is called the indirect technique, and generally we call it a little blind procedure because we are not actually visualizing the sinus membrane, or the Schneiderian membrane is not been visualized. but we blindly, on an average, we know where it is and how much it can lift it. So using that knowledge, we, without actually visualizing the membrane, we give a tap and slightly elevate it. So it is indirect membrane, but it can be done in cases of where we need to lift about 3 to 4 mm of bone. So once we have done this, we generally wait 6 months and then go ahead with the crown placement. Thank you for a patient hearing.